The broadcast is now starting. All attendees are in listen-only mode.
Good morning, and thank you for taking time today from your busy schedule to join the New York State Association of Counties on this important webinar. My name is Stephen Aquario, and I'm the Executive Director of the New York State Association of Counties. It's been over 100 days that New Yorkers have collectively battled this unprecedented health crisis. And while there were many unfortunate circumstances and tragedies along the way, today's numbers show we're winning. We're winning because of the efforts and the education to the public you on this call have all made. While the numbers have improved, it's now time to face a new challenge, a challenge of reopening our economy, and as part of that, bringing back to full staff our local government workforce to continue to serve the public. The phrase, the new normal, is often used these days, but what does that mean? It means we'll have to reopen, but reopen safely in the new normal. We've worked too hard to come back, too hard to beat back this virus, only to have it come back just as strong in the summer and in the fall. Today's webinar will help teach you as county workforce administrators, HR professionals, leaders, how can we bring back our employees and allow the public back into our buildings in a safe and prudent way. We need to continue with our jobs and our services, but we owe it to our employees and the public to do this in the best and safest way possible. So we'll hear from our presenters today about issues like workplace safety, proper signage, proper social distancing, but also we'll hear about issues such as work share programs, split shifts, where we could do 3 on in the office and 2 filing for unemployment, and to see if those programs are permissible and would benefit the public and the local government employers. But before we start, I'd like to thank a special thank you to OpenGov for sponsoring this webinar. Without these partners, we would be hard-pressed to continue to bring such high-quality solutions to county government leaders. So I'd like to thank OpenGov. OpenGov has an integrated cloud solution on the market, providing local government leaders with a very user-friendly technology solution for budgeting, financials, performance, communications, reporting, and permitting needs. I'd like to thank OpenGov again for sponsoring this webinar today. For more on OpenGov solutions, visit opengov.com. Thank you very much to OpenGov. At this time, I'd like to turn the webinar over to our panelists. First, we'll have William Lowe. William has spent more than a decade focusing on the labor and employment and corporate needs of his clients. Bill provides corporate counsel to businesses with transactional needs and at all stages of business development, including entity formation, mergers, acquisitions, contract compliance. He also advises clients on compliance with federal and state labor discrimination laws, terminations, restructuring, and all aspects of labor relations. Next, we'll have Karlee Bolaños. For almost 2 decades, Karlee Bolaños has helped employers navigate the complexities of labor and employment law. Her legal practice focuses on counseling and representing employers in all aspects of labor and employment law, including federal and state labor and discrimination law, Affordable Care Act compliance, the National Labor Relations Act, the New York State labor and civil service laws, wage and hour laws, privacy laws, constitutional issues, and immigration law. A special thank you to Karlee for helping the New York State Association of Counties and its membership from across the state on so many labor-related issues over the years. Karlee, a special thank you to you. First up, let's go to Bill Lowe. Bill, the floor is yours.
Perfect. Well, thank you very much for the introduction and the opportunity to speak with you all today. Karlee and I have a lot to cover today, and we also want to make sure that we can address any questions that come up. So please continue to submit questions, and we'll do our best to get to all of them as we kind of go through all of our materials here today. I think first we can kick things off by just going through the agenda briefly to give you an overview of what we plan to talk about. First, we're going to discuss the executive orders, and we don't plan to discuss all 39 executive orders, but we really want to focus on what really matters most for municipalities. And that comes down to really 2 executive orders, 202.4, and then the most recent one 202.39, which was published yesterday. Next, we're going to go into some key considerations to think about before your reopening. And I kind of look at this in two perspectives, if you will. First, take stock of what you've been doing for the past 3 months, and then give some careful consideration to what needs to be done now to ensure that once you are able to, you can really reopen in a safe way for both your employees and visitors who come to your locations. The next topic on workplace safety precautions, we'll go into some detail on things you should be thinking about now, again, to ensure that when folks are coming into your locations, they're going to be returning to a safe environment. We'll also spend some time discussing best practices for developing procedures for dealing with situations when you have infected or exposed employees in the workplace. And in that, we'll also discuss how to handle employees returning from work following an inspection, or rather an infection or an exposure. This will be guided by the Department of Health's May 31st guidance, which I'm sure many of you are aware of. And then finally, we'll finish by discussing some common issues that we've been encountering so far, really focusing on some personnel and union-related concerns that we've been seeing. Okay, so first we'll get into the executive orders. So through yesterday, the state has issued 39 executive orders since the pandemic first struck. And the first executive order was issued on March 7th, which declared the state of emergency for the entire state. Unfortunately, when it comes to public employers, the state really left us in the dark for much of the past 3 months as far as guidance. After issuing Executive Order 202.4, which was the first order to specifically address local governments, the state didn't really make any effort to articulate any meaningful rules or guidelines for municipalities to follow until yesterday, when Executive Order 202.39 was published. Again, so Executive Order 202.4 was really the first COVID-19 related executive order that pertained to local governments. I'm sure many of you are familiar with the pertinent language of this order, which is shown here. But essentially what it did was it declared that effective March 17th, all non-essential personnel were to work from home or take leave without having their leave accruals changed. So it did not prohibit local governments from to have essential employees come into work. Only that the number of essential employees coming to work had to be less than 50% of the total workforce. So it was at this time that we all started operating in this kind of 50% mindset for our operations. But on top of it, the state didn't give any guidance surrounding what essential and non-essential meant in this context. So we were left to kind of analyze our workforce and make determinations, whether on a department by department or really an employee by employee basis on who would be viewed as essential or non-essential. Now, this was originally sent to expire on April 15th, but it was extended multiple times. So by Executive Order 202.14, 202.18, and 202.29, and that the latest one had it expiring on June 7th. But really, that was the extent of guidance that we had until this 202.39 was issued. And this really is the first time we've had definitive guidance for local governments on reopening plans. The critical language here we have on the slide, and what it does is it modifies 202.4 to apply only to local governments that have not yet satisfied the public health and safety metrics to be eligible for Phase 2 reopening. And then it further states that municipalities that are in Phase 2 regions may bring non-essential employees back to work starting 2 weeks after the region satisfies the metrics to reopen Phase 2. So as a reminder, as of yesterday, when this was kind of first published, all of New York except New York City and Long Island were in Phase 2. So a way to think of it is by about Monday, June 15th, any local government outside of those two regions can begin to bring back all non-essential employees. And so I think part of all the confusion for municipalities around reopening was that virtually all the guidance found on the New York Forward website really fails to reference local governments and public employers in any way. So for private employers in Phase 1 and 2, the state has provided a host of guidance on reopening. But again, aside from general guidance, including frequently asked questions, you have each industry that's been permitted to reopen has been given specific summaries on reopening guidelines, detailed reopening guidelines, and a fillable reopening plan. But none of this material has been made available for local governments thus far. And frankly, there's been no mention of anything similar coming. And there isn't much time to produce all this now as we could begin reopening fairly soon. So with it being somewhat unclear, we kind of have to look to what's out there to kind of base our decisions on. One of the FAQs prepared by ESD did offer some potential guidance. There they stated that for all essential businesses that have not yet been issued industry guidance, they must continue to comply with the guidance and directives for maintaining a clean and safe work environment that have been issued by the Department of Health. And every business, even if essential without industry-specific guidance, is strongly urged to maintain social distancing measures to the extent possible and require use of masks when social distancing cannot be maintained. So that's not really a lot to go on when we're thinking of really reopening, our municipalities here. So, I think if you're looking for a roadmap, until we see whether the state produces anything that's specific to local governments, I think our suggestion would be to spend some time reviewing what has been made available on the New York Forward website for phase 1 and phase 2 entities and look for what there may be applicable to your operations. I think a good example of this are the guidelines for office-based work on the phase 2 materials. So if you go to New York Forward, you can find phase 2 materials, and there's the resources for office-based work. I think for a starting point for a lot of our operations, that's a good place to say, okay, I don't have anything, again, specific to municipalities yet, but I can at least look at this, and in the absence of anything else from the state, if I follow this, I should be at least making a best effort to reopen in a safe way. And one additional thing is because there's little guidance available and the timetable here is somewhat accelerated, I'd be prepared for some back and forth with representatives for your unionized employees. So without, again, clear directives from the state on reopening, I think you can expect that unions will be looking to weigh in wherever possible. And we'll obviously get into some of these specific considerations later on, but just something to keep in the back of your mind that you may be able to make some plans, but just be aware that you may have some other parties looking to weigh in on the plans that you're making. So next, we're going to move into key considerations to take on before you're actually reopening. So you have the pre-opening assessment of operations. We think it's important to kind of take a look at what you've been doing to date since you've been operating with just your essential functions going on. We'll look at coming up with an employee return plan, the continuation of remote work to the extent that you've been utilizing telework so far. We'll talk about planning for addressing employees who do not want to return to work, which is likely an issue that you'll all be encountering in one form or another. We'll also spend a lot of time talking about specific workplace safety measures, and then also looking into creating or modifying existing policies that we have that may be implicated as we're reopening. Also the need for some training on employees as we are kind of entering a new phase here, and what communications may go along with that. So first, the pre-opening assessment of operations. Again, I think it's really important to give some thought to what you've already been doing for the past 3 months. So take a step back and really give yourself a type of self-evaluation so you can approach this reopening phase with a good sense of what's worked and maybe what hasn't worked so far. This slide has several questions that I think you should be asking yourself, and we'll just highlight a few here. But first, I think you need to go through a review of what locations or operations have been shut down, whether entirely or partially, because I think your reopening process is likely going to differ pretty dramatically if you're opening a location or department, for the first time in 3 months, as opposed to just fully staffing an operation that maybe has been partially shut down for part of the past couple months. And you may be able to model what you've done from a health, safety, and cleaning standpoint at locations that did remain operational across other locations or departments that are now going to be coming back online, be it partially or fully. You also should look at what will be needed other than employees to get operations up and running. I think the big items to focus on here will be, masks for both employees and potentially visitors, PPE, thermometers, and adequate cleaning supplies. If you don't have sufficient amounts of any of these now, you should be looking into ways that you can stock up on these types of items in the short term. I think you can also take a look at whether any modifications to services have been implemented during the past 3 months and determining whether those modifications have been successful or not. Maybe you've moved some offerings through your clerk's office to an online method, and maybe that's been very successful. So as you're planning to reopen, that may be an area where you're going to look at kind of keeping status quo because, again, what you've adopted has worked for the time being, and that will give you an opportunity to maybe limit the number of employees who are coming back to the physical location. And also, I'm sure a few months ago, many of you sat down and went through the exercise of making a list of what essential services needed to be done in person or with employees physically present. And now we really need to do that again for all non-essential services that we've either been put on pause or offered in a reduced manner. And I think at first, it's not a bad idea to really focus this on the services that must be done from county facilities or that truly require person-to-person contact. And at the same time, I think you can also look at what about services that you've moved remotely. So in situations where moving things remote has been successful, maybe you can place those items in the back burner, as I mentioned, just a second ago. Or maybe some of these switches can be made permanent. But again, it's really relevant in situations where doing so can either reduce the head count of folks that you're bringing physically back in, or where they may, provide some cost savings. We're all entering uncertainty around budgets and funding sources. So if we can develop a strategy for reopening that also maybe alleviates expenses, that's not a bad thing. I think you can also view operations that involve public access to facilities differently. It's important to understand what restrictions that you may have in place already and whether changes will be needed to make those locations kind of safe once you're fully reopened. And then finally, I think with this, an important point is you don't need to go at this alone. You can look to some of the phase 1 or essential industries in the private sector who have already been open for some time now. Maybe you've seen things that might translate to your operations. The construction industry. Maybe you've seen some things done in the construction industry that may translate well to your DPW or parks departments. So again, in the absence of clear guidance from the state, let's use any resource available to help guide our decisions going forward. And also, pull in experts. So if you have questions on exposure prevention or contact tracing, make sure you utilize Department of Health officials wherever you can. Again, any resource you have should be pulled into this process now, especially because the timeline's rather accelerated now. And we can go to the next slide. So, just like at the beginning of the process, again, we had to go through the analysis of who is essential, who is not essential. Now it's a similar process with respect to bringing folks back to work. And I really think there's two aspects to this process. First, who are we actually going to bring back? So did we conduct layoffs and furloughs? And if so, did we learn that maybe we don't need some of the folks that we originally had? Also, are there some employees who, for maybe performance or productivity reasons, we might like to use this as an opportunity to permanently sever the relationship? So, things to consider as we're making these decisions. And also, if you're planning to only bring back a portion of your workforce, it's really important that you make sure to utilize specific criteria for making these decisions and then fully analyze these decisions to make sure that they're not adversely impacting any protected classifications. So you don't want to kind of put blinders on as you're making these decisions on bringing folks back in who have been non-essential. You really want to make sure you're looking at the big picture to prevent against any kind of unintended impacts of how we're making these decisions. Then the second consideration is, when do we bring folks back to work? So a lot of the guidance out there suggests that phased reopening is really the best course of action. And I think a benefit to this is that you have the opportunity to kind of identify operational issues and then correct them almost on a rolling basis before your operations and workforce are back to full capacity. So you can kind of take this in steps to make sure that it's as smooth as possible, as opposed to just kind of opening in full right out of the gate before you've had a chance to really see how some of the measures you're implementing are going to play out in reality. And then finally, again, I think throughout all of the guidance that we're going to give, a key point is communication. Employees, vendors, general public are going to have a lot of questions surrounding reopening plans. I think just, once you've made determinations about which employees will be coming back and when they're going to be coming back, you're going to want to make sure this information is made available, to the appropriate stakeholders, kind of in a clear way as soon as possible. So the next slide gets into a topic that I'm sure many of you here on the call have devoted a considerable amount of time to over the past few months, and that's teleworking or remote working. I think for most public employers, this pandemic has really represented the first time that working from home has been implemented on a large scale, or really at all. And I think now, as we're preparing to reopen, we can assess the teleworking that's taken place so far and determine, whether these arrangements can or should continue, and if so, whether we should make any modifications to how things have been going so far. So you may be able to have individuals split their time between physically reporting to work and teleworking, particularly if you've had some success with teleworking arrangements so far. This gives an ability to help limit the number of people who are physically in the workplace on a given day, but it also allows you to balance that with ensuring that personal connection between employees and their work kind of remains intact. And again, now we do have this opportunity to assess how teleworking has been going so far to the extent it's been implemented. So, I think you should take a look at, are there certain aspects that have really worked particularly well that we might want to implement with non-essential employees who will be resuming their duties in the near future. I think if you're planning on having some of your work from home arrangements continuing, it also would be a good idea to look at providing employees with equipment to facilitate that arrangement. So, we may have kind of made these decisions pretty quick, a couple months ago, without thinking if it was going to be long-term or not. But if some of these arrangements will be continuing for the foreseeable future, it's important to take a look at it to say, okay, do our employees have the tools they need to be as effective as possible under this arrangement? Again, if it's not going to be a short-term arrangement. And then finally, I think it's critically important to take a look closely at your teleworking policies. So our experience was that a lot of employers didn't have comprehensive policies in place at the outset of the pandemic. So policies or temporary guidelines were really implemented when employees first started working from home a couple months ago. But I think now's the time where we should really be reviewing those policies and guidelines to ensure that we're following them as we're ending or modifying some of the arrangements that we put in place. And I think if the policies or guidelines you have don't afford you a fair amount of discretion with respect to these decisions, now's the time to consider making revisions to them as part of your reopening process. Okay, so this next slide discusses a topic that I think really needs to be given consideration before you progress with reopening on the large scale. And that's what to do when an employee does not want to return to work or has some restriction on their ability to return to work. You are likely going to encounter a variety of reasons or justifications for why employees do not believe they can return to work. And I think the most important point we can make here is that you need to develop a clear internal policy for how to handle these scenarios. And I'm sure that you encountered some, during the past couple months with some of your essential workers, but I do think that you're going to see kind of an increased amount of these issues as you begin to reopen. So I think you want to be prepared for both employees who are requesting to not return and employees who may be returning but are in high-risk categories. And I think in addition to having a policy, you really need to make sure that managers and department heads understand that policy and how to appropriately respond to requests of both types. And we'll get into this in a little more detail later, but the interplay of the FMLA and ADA can be tricky in certain scenarios. So you really want to remain mindful of your policies and practices that apply outside of the COVID-19 context that may be applicable. And finally, it's also important that your managers and department heads are knowledgeable about the kind of COVID-19 legislation that's been passed. So that would be the New York specific COVID-19 leave, and then the federal emergency paid sick leave, as well as the emergency FMLA. because our managers and department heads may be the folks who are really involved in fielding requests and questions from employees as we're preparing to return to work. So it's important that we've provided them with the sufficient information so they truly understand these statutes, as they may be the ones who are dealing with questions on them most frequently. So we're not going to get into a lot of detail in the New York and federal kind of COVID-19 leave laws now, but I do think it's worth having a little refresher on them. So first, you have the New York emergency leave law. Under this, employees are entitled to 14 days of paid sick leave if they're subject to mandatory or precautionary quarantine order related to COVID-19, but not if they are asymptomatic or have not yet been diagnosed with a medical condition and are physically able to work remotely. Second, you have the federal emergency paid sick leave. Under this, employees are entitled to 80 hours of paid sick leave for several reasons, and those are if they're subject to federal, state, or local quarantine, if they are advised by a healthcare provider to self-quarantine due to COVID-19 concerns, if they're experiencing COVID-19 symptoms and are seeking medical diagnosis, if they're caring for an individual subject to a federal, state, or local quarantine order, or an individual advised by a healthcare provider to self-quarantine due to COVID-19 concerns, if they are caring for their child, if the child's school or daycare is closed or unavailable due to public health emergency, or they're experiencing any other similar condition to the conditions that I just mentioned. And again, that's for the emergency paid sick leave. And then the third piece is the emergency FMLA. And this is an expansion of the FMLA through the addition of one new qualifying reason for leave, and that is for an employee who is unable to work or telecommute to care for his or her child under the age of 18 if the child's school or daycare is closed or their child care provider is unavailable due to a public health emergency. So if you have additional questions on those leave provisions, our website has some alerts that we put out when they were first passed that will give you some detail or a refresher on those if you need a little more information. But we just wanted to kind of remind you of those briefly here.
And Bill, NYSAC has posted the prior webinar that we conducted on these leave laws. It's available from the NYSAC website and on YouTube.
That's a great point. Thank you. And then also, for those of you with healthcare employees, there's a fourth leave provision that you're likely aware of, and that is guidance that was issued by the New York Department of Health on May 17th. So just a reminder, while the federal legislation exempted healthcare employees from coverage, under the Department of Health special rules, the relevant portion at least, they provide that employees directed not to work because they are suspected of or confirmed to have COVID-19 or were exposed to COVID-19 are essentially to be treated as if they are subject to a quarantine order for purposes of the New York COVID-19 leave provisions. Again, that was kind of a narrow piece of guidance issued by the Department of Health, but may be applicable for those of you who have healthcare employees. So the next slide is kind of a hypothetical that's worth considering. So say you have an employee that doesn't fall into one of the FFCRA categories, nor do they qualify for New York COVID-19 leave, but they have a doctor's note indicating that they have a medical condition that's potentially impacted by COVID-19. What do you need to do here? Well, you need to work with the employee to fully understand the scope of the condition, and if possible, accommodate the situation they've identified. So really we need to look at these situations through two different federal statutes. First, the FMLA. Generally, ordinary FMLA would not likely apply in the case where an employee is concerned about COVID-19 ailments. But again, that's generally speaking. There may be scenarios where it does, so you need to kind of approach these from looking at the FMLA. The second one, though, would be the ADA. And so under the ADA, you need to work with employees to reasonably accommodate a disability situation that they may identify. And in these cases, you're just going to want to follow your standard process in this regard. So it's important that we don't lose sight of kind of long-standing practices or procedures we may have in place related to these federal laws as we're approaching things from the COVID-19 context. This next slide focuses on some relevant ADA considerations, which again, they can be complicated in the context of COVID-19 issues. But again, to reiterate the point that I just made on the last slide, the first thing to remain mindful is that just because we find ourselves in this pandemic, we still need to follow our normal process of providing employees with a disability with reasonable accommodations, unless doing so would present an undue hardship. So in cases where someone says they can't come to work because of an underlying health condition, we need to go through that standard reasonable accommodation process. And I think in these circumstances, you're likely going to be focused on three types of accommodations. The first would be, PPE or work environment related changes. So these are the types of accommodations you can make to further protect an employee with an underlying disability who's going to be in the workplace. Things like using plexiglass or face shields. Second would be leave as a reasonable accommodation. So this would be permitting someone to remain on leave until they're comfortable or permitted by their healthcare provider to return to work. And then third would be teleworking as a reasonable accommodation. In cases where this is an option, I think this really strikes the best balance between protecting employees from infection while also ensuring that job duties can be performed without the need for temporary staffing. So where available, that third option, might present the best accommodation that we can offer. You can go to the next slide, please. So now we're going to turn our attention to specific safety measures that you should be thinking about and implementing as part of your reopening process. We really think of these in 7 categories. Those would be social distancing at work or establishing physical contact protocols, workspace modifications, PPE, employee personal hygiene, workspace cleaning and disinfection, employee health screening, and then visitor health screening or obtaining waivers. So we believe these are all items that we need to be considering now as we plan to reopen more fully here in the coming weeks. So first is social distancing, which is probably the most familiar to everyone here because we've all been living with social distancing in our personal lives for the better part of the past 3 months. But now we need to translate these familiar concepts to the work setting. I think the principal concept to be considering here is, can workspaces be redesigned or rearranged to ensure 6 feet of distance between employees? So again, the basic goal here is to ensure 6 feet of distance between personnel, unless for safety purposes or where the core function of the position requires closer proximity. And in those cases, we need to make sure that employees are utilizing PPE. In situations where employees are going to be less than 6 feet apart from one another, or there's a reasonable likelihood that that could happen throughout the course of the day, you should ensure those employees are wearing acceptable face coverings while at work. And where it's not possible to ensure proper social distancing is going to be maintained, you can look to ways to limit the number of employees on site at any given time. And you can use things like staggering hours, rotating shifts, rotating days on site, or really any other mechanism to ensure sufficient space is available. So if the physical location won't permit for acceptable social distancing, look to scheduling alternatives that may allow you to meet those needs anyway. Some other important considerations are posting. We want to post social distancing markers with tape or signs that denote 6 feet of spacing in commonly used and other applicable areas. You should also plan for areas where employees commonly gather. So think of, stations where folks clock in and clock out, or health screening stations. Your front desks or reception areas, break rooms, copy rooms, bathrooms, areas where employees are commonly getting supplies or tools. What steps need to be taken to ensure social distancing can be maintained in these areas in particular. It's also advisable to limit in-person gatherings as much as we possibly can, which again, frankly, in our personal lives, we've become accustomed to over the past couple months. I think you can look to continue using tele or video conferencing wherever possible to avoid large meetings. And again, over the past couple months, we've gotten used to the Zoom calls and Zoom meetings. This is something that even if we are reopening, we might look to lean on again to ensure that we are maintaining social distancing while we have our employees back in the workforce, or in the workplace rather. Another item to give some thought to is what can be done to limit sharing workspaces, equipment, and supplies. I see office supplies and tools as being a big issue. you're going to want to think about making arrangements either to have extra resources available to cut down on employee sharing, or a way to thoroughly ensure that you are disinfecting and cleaning tools and office supplies kind of after every use to ensure that employees are not contaminating them and then they're being shared among the workforce as a whole. And this next slide just repeats some of the items on the previous slide, so I think we can actually go to the next one. So this is workspace modifications. So after you give thought to what you can do to help ensure employees are able to properly social distance while they're at work, I think the next thing to consider is what can we really do to change our physical workspaces to further ensure employees are safe upon returning to work. This just lists a few actions worth considering. You can place partitions or plastic barriers between reception areas or any other employees that may directly interact with employees or the public on a regular basis. In cases where this isn't feasible, plastic face shields will be an acceptable alternative. You can look at ways of separating employees who normally work in close proximity. So that could be moving workstations or reconfiguring workstations to spread folks out. When you're looking at break areas or meeting rooms, one thing you can do is you can just simply remove chairs so that employees aren't able to sit in as close a proximity to each other. So you may have a 10-person conference room, but if you can remove half of the chairs to help just ensure that folks are keeping that space even if they are using that room once they return. Where feasible, you could work to create a controlled traffic pattern in each physical location. This could include things like creating designated in and out doors and generally controlling your workplace entry points. You can also require individuals to walk in one-way lanes in all hallways and corridors, again, to avoid kind of traffic or congestion where folks are going to be in close proximity to each other. This next slide just contains a couple additional suggestions or things to be thinking about. I mentioned signage earlier. You should ensure that you're posting signage prohibiting entry of individuals who have symptoms of COVID-19. In all likelihood, you may have put some of these signs up right at the outset of the pandemic, but it's just important that we look at all of our work sites to make sure that proper signage is up if we didn't have it up initially. I think many are electing to maintain a log of individuals entering facilities. If you're doing so, you're going to want to coordinate how this is going to be completed going forward, as you may be opening new facilities in the coming weeks. And then another thing to consider is, whether touchless systems can be installed in places where you don't already have them. So, can you have motion sensor doors or sinks or hand dryers? Again, just taking stock of your physical workspaces to see where those types of improvements might go a long way to, again, maintaining safety as folks are returning in. And then I think the last point here is one that, is important to just look at. When you're thinking of bathrooms, elevators, common areas, lunchrooms, conference rooms, stairwells, entrances and exits, these are areas that we really want to focus on. Those areas where, even under normal circumstances, they're high traffic, employees are often interacting in them. Let's really focus on those types of areas and what we can do to ensure that as we are expanding our workforce, that those don't become kind of unsafe areas for employees that are in the workplace. And with that, I'm going to turn it over to Karlee.
Thanks so much, Bill. Hey, Bill, while you were talking, I was receiving emails from our clients and attendees asking for underlying materials that you've been mentioning, like plan documents. In particular, people have asked about the waiver form that you mentioned for visitors. People have asked about, hey, do you have like a training for managers on the FFCRA? Do you have like a one-page summary that we could use as a cheat sheet? Do you have applications? So I've gotten about 15 different emails on that. We have all the underlying materials, so we'd be happy to help if you need those underlying materials. We've been working on those with many individuals so far, and so you can just let us know what you're looking for, and hopefully we can be able to help you with that. So with that, I just wanted to mention that because that has been sort of a priority as you've been speaking so far. Keep asking questions on chat if you have any. We'll get to those. Keeping with the workplace safety, PPE is a very big one. Remember, the executive order is still in place for all of New York State employers, including public employers, whereby we have to wear face coverings if we're less than 6 feet apart, and that includes for other employees, coworkers, and for the public. It is essential right now before you reopen to identify all of those areas that you have sort of closed down where there's going to be proximity between people of less than 6 feet. So make sure that you've identified those and that you're using PPE in advance, that you don't have situations where people are coming back to work, they don't have the appropriate PPE in place, and then that's going to create issues in the workplace for you once people are already there. Departments are responsible, should be responsible, or maybe you've identified another way that PPE is distributed within your workforce. Make sure that all departments, all managers, supervisors understand their responsibility as supervisors to provide that PPE. I know that a lot of times in the public sector, our supervisors are in the same unions with employees, and sometimes through civil service process, we don't have the best people supervising situations. It is right now a #1 priority for supervisors to provide PPE. Telling an employee, I don't know where it is, I'm not sure where the face shields are, I don't know where the gowns are for employees that are required to wear those things, are unacceptable responses that really supervisors need to be held accountable for, because that's where we've seen any type of spread of infection has been when we don't apply appropriate PPE in the workplace. We can learn a lot from the hospitals all around New York State, where through adequate personal hygiene and PPE usage, we really have not had the type of transmission in those healthcare places that other places across the state and the country have seen. So hygiene, PPE, important. It's the supervisor's responsibility to provide that, and supervisors really need to be trained in this, especially supervisors who have been home and are coming back into the environment. And this is just a disconnect that I think I should mention now too, that we sort of have two types of employees right now. We have employees that have been in the thick of it and have been learning as we've gone through this crisis, and then we have employees that have been home. And so your central office staffing, your central county staffing needs to understand that there's new employees coming in, basically, even if they're 30-year employees. They're new to this COVID situation and they don't know all of the things that the essential employees who have been working already know. So managers, supervisors, central county administration needs to understand that we have two different types of employees. And we have noticed already a clash between those two types of employees. There can be some irritation on the part of the employees that have been in the workplace already versus the people that are coming in and have not been going through the process. So you need to plan for all of those, and I just kind of went sort of fit in with what I was talking about here with PPE. So I did want to mention that situation as well. One other thing I want to mention about PPE is something that Bill touched upon, is that PPE is an adequate accommodation for an employee that indicates that they don't want to come back to work because of an underlying health condition. The EEOC has supported PPE as an appropriate accommodation in some circumstances. So Bill mentioned, if an employee comes forward and they have a note, they've been working at home and now they're being called back, maybe more suddenly than they thought they were going to be called back based on the executive order that was published yesterday. So now an employee has been home, they're comfortable, they love hanging around with their dog and being in their sweatpants, and they don't want to come back to work, and they bring in a doctor's note indicating that they have an underlying health condition, and the doctor's notes lately have been very bold to say employees should continue to telework. You do not need to accept that accommodation, particularly if it's not feasible. As Bill mentioned, sometimes there may be circumstances where we would like people to continue to telework, but that should really be on a more structured basis, and trying not to provide that necessarily for all employees who come forward with that note. There are some employees whose underlying health condition is so serious or their work environment is such that that would be a reasonable accommodation to continue to work at home, but in most cases, PPE has been a very reasonable accommodation. And I mentioned the employee that's trying to stay at home. There's also employees who are really scared to come back to work and are very concerned about the virus. And listening to those employees and talking to those employees and educating them about PPE use and how that has controlled the spread of the virus and made people with underlying health conditions safe in the workplace also goes a long way. So there's really two types of employees. Some employees that may be trying to take advantage of the situation and have doctor's notes for authority, and others that are really just scared, confused about the spread of the virus and need you to listen to them and talk to them about PPE usage. And on the next slide, we get into employee personal hygiene, which, like PPE, I think is the second most critical thing we can do to stop the spread of the virus. So we have to, as employers, promote healthy hygiene. We need to train our supervisors to teach employees about employee personal hygiene. If you haven't already created an employee video for personal hygiene, you should do that. You need to have appropriate signage. We've got a link here on the slide. CDC actually has very helpful resources in this regard. They have training videos. They have signage that you can just pull down off of their site and use as you're posting in the workplace. Great signage available. And making sure as an employer that you have adequate hand washing stations for all personnel, and that needs to include soap and water and towels. Paper towels are recommended by the CDC. If those things are not available, alcohol-based hand sanitizer, making sure that employees that are out in the field have hand sanitizer or other adequate cleaning supplies. Now, the next slide, we get into the workplace cleaning and disinfection, and there's about 4 slides regarding workplace cleaning and disinfection. It's not that this is more important than PPE or workplace modifications or social distancing or hygiene. It's just that there's a lot of information available from the CDC about workplace cleaning and disinfection. If you haven't already disinfected areas during the shutdown, you need to look into disinfecting those areas now, and you should be following the information that the CDC has available for you. There's really cool guides and posters that the CDC has created, which can teach people a lot about cleaning and disinfection. And one of our links there is to a handout that is like a 12-page guide for cleaning and disinfecting. You really should make sure that your staff that are responsible for cleaning and disinfection at the high level staff have actually reviewed the full guidance document for cleaning and disinfecting from the CDC. And we can also, Bill and I can share copies of this with NYSAC and with you if you'd like copies of this. Have the high level employees review this and create a brief training so that the people that are performing the cleaning and disinfection can understand these rules and are complying with the CDC guidance. If somebody were to get sick, a member of the public or an employee, and it can be shown that we haven't reviewed the guidance, we haven't trained our staff regarding the guidance, it can create more liability, unnecessary liability for the county. So these are important action items. And if you weren't planning on reopening as soon as maybe you will be now that 202.39 executive order has been passed, this is an item that you really do need to fast track. And so the next few slides are on workplace cleaning and disinfection. It just really reiterates some of the important points from this guidance document that the CDC has provided. So we won't go into detail on those slides. If we move right to slide 27, it's a big item. Health screening. Bill and I have been, and our office has been receiving a lot of questions about health screening. So your first question that you need to ask is, will you screen both employees and public visitors? Have you been doing that already? How has it worked? Where are the kinks? How can you work those kinks out? So public and visitors, preparing for additional volume as you reopen. Do you want to bring back all of the employees, but sort of phase in the public coming back into facilities so that you have time to put in the appropriate health screenings? And when I talk about health screenings, there's really 2 parts of a health screening. It's going to be your temperature checking and then your health assessment questions. So those are really the 2 components of a health screening. I will tell you here today that the EEOC has approved both of those components of a screening. You can perform temperature checks legally, and you can ask health assessment questions legally if you're asking the appropriate questions. So EEOC, the Equal Employment Opportunity Commission, only wants us asking questions that are specific to COVID, and we have those available for you as well. And then there's types. Okay, so if we're talking about screenings, temperature checks, and health assessment questions, there's different ways that you can approach that. The ways that we're seeing people approach that are just the traditional in-person type screening. There's new apps that are available for screening. A lot of counties are creating sort of easy little applications themselves where an employee might sit down to log in for the day and they are answering questions before they start work, just a few series of questions on their computer. Some counties are using just a paper certification up front regarding the types of illness effects that a person might have, and certifying that if the employee has any of those symptoms, they will disclose those symptoms immediately to a supervisor. So that would be like a one-time or maybe a weekly or bi-weekly paper certification where employees are educated about the symptoms of COVID-19 and are certifying that they don't have any of those symptoms, and if they did, that they would be notifying their supervisor or any designated person in the county immediately. Self-screening, complete self-screening, so that employees are told before you have to come to work, you have to take your temperature and you have to answer the following questions. Do that every day. By coming to work, you're acknowledging that you've done that. And then I had mentioned like a payroll type login. So on the next slide, we've got for you the type of questions that are asked on the screening, and these are the types of questions that the CDC and the EEOC have specifically approved as being asked. Now, there's a link at the bottom of the slide to the CDC list of symptoms for coronavirus. Folks, this regularly changes as new symptoms are detected. So in the beginning of our health screenings, we weren't asking about loss of taste or smell, or most of us weren't. And that has proven to be quite a notable early symptom of COVID-19. So most of us have already added that to our screening questions, but some of us have created our initial screening questions and it just asks about fever, cough, sore throat, and we haven't updated that. We really should update that as soon as possible, but certainly before any reopening, to make sure it includes all of these symptoms, and that we're asking employees about these symptoms. And then the last few bullets are additional questions that we lawfully may ask employees and visitors if they've been in contact with an individual diagnosed with COVID-19 in the past 14 days, and if they've traveled internationally or domestically in the past 30 days. Travel is a big issue. We're going to talk about it momentarily, but we are lawfully able to answer this question. Currently, the CDC guidance regarding travel indicates that any international or domestic travel has is sort of a prohibited type of high risk activity. So that's any travel right now within the United States is a high risk activity. I'm sure that will begin to change, and certain international destinations will not be considered high risk, and eventually certain domestic locations will not be high risk. But as we sit here today, CDC guidance has all travel as a high risk activity. So that's something important to keep in mind. But these are the screening and questions that are lawful and appropriate. So just before we move on to the next slide, I want to cover a few things about screening because we have been getting so many questions about this. So one of the things you want to be thinking about is what type of temperature check. If you do not have access to, thermal type thermometers or thermometers where you don't, the no touch type of thermometers, and you're considering using like something that goes in somebody's ear or mouth, I think our recommendation has been to avoid taking a temperature and moving towards a self-check at home, because that kind of screening contact, we're putting things in people's mouth or ear, is going to possibly be more of a high-risk activity than checking the temperature. So if we do also tend to recommend, as I mentioned, there's a lot of ways to do it, and it really does depend on your organization and the amount of flow of people that you have in the organization. But it does seem like one of the more effective ways may be a more traditional way of just having people certify at the port of, the port that they're entering into, limiting the sort of areas where people can enter into the workplace, and making sure that you're able to keep people safe in that setting. So we certainly don't want large groups of people congregating in areas, meaning if they're coming in for a screening and there's a line, make sure that people are 6 feet apart. That will be an added task. And if you really don't think that you're able to do that, our recommendation would be to move away from an in-person screening and move towards something where you're using an application or a self-screening process. Although that might not be the best case scenario, it's certainly better than causing traffic and congestion before people come into the workplace. So it will depend on what your county is able to do there, but those are the different ways that you can do that. On the next slide, we talk about visitor checks. Visitor checks, it's a decision that a lot of counties need to make. Will they be checking visitors as well as employees? Employees really tend to support the visitor checks. Employees are very worried about third parties that are entering our facilities, making sure that they're checked. There are some ways that you can limit some of that checking that you need to do. So if you're working with vendors, requiring the vendors to check their employees before they're sent to your location, that can be true for contractors as well. And then what about people that you are doing business with more regularly, like residents and inmates? You should have a policy in place on whether or not you're screening those individuals. But more important, probably the people that are coming in and out of the facilities need the screening, like the contractors and the vendors. So a lot of counties are setting up separate areas where deliveries can be made that are completely away from the employees and others, so that you can avoid having to screen those people that are making the deliveries, not letting people into the facility, but having tents set up and outside and other things where people can drop off materials and not have to be screened. And then there is a possibility of having a waiver form for people that you're dealing with, making sure that they're signing off on certain types of understandings. It's certainly not going to waive all liabilities, but it might help, particularly with vendor type contracts, to have a waiver in place. Maybe not as helpful with the public, but certainly with any people that you're doing business with, to include this type of waiver would be a good idea. So we have, some of you had emailed about samples of those, and we do have all of that material available. So on the next slide, I already mentioned this, the EEOC permits temperature checks. Important things to remember, although temperature checks are permitted, it is a medical screening, and medical screenings under the ADA, the Americans with Disabilities Act, as managed by and overseen by the EEOC, have been prohibited under the ADA. Employers are, in only very limited circumstances, allowed to perform medical screenings, which this is. So the EEOC says these must be kept confidential. The EEOC recommends that only certain individuals be allowed to check temperatures, and that those individuals have training regarding confidentiality. I actually believe, based on a recent program that the EEOC posted on their website, also available on YouTube, regarding temperature checks on other screenings, the EEOC indicated that they believe if you do not have trained personnel, that you're not in compliance with their regulations for screening. So make sure that your personnel, if you're doing in-person temperature checks, understand confidentiality, making sure that, for example, they're checking somebody's temperature in a private area. So if there is some type of a line at entry to be screened, that the person who's being screened is moved somewhere a little bit separate, so that employees, if the person does have over 100.4 temperature, which is the CDC recommended temperature, anything that or above that an employee not work, that it's confidential, that information is not being shared with others in the organization. On the next slide, I do mention the training there and a few other important points from the EEOC guidance and rules. So making sure that you adhere to that confidentiality, making sure that you communicate that you're performing these checks with employees in advance. So if you're sending out a communication to employees with your reopening date, if you are performing these temperature checks and screenings, that you're informing employees of this. And I do just want to mention that in all of the New York Forward materials that Bill mentioned do not specifically apply to municipalities, but are certainly very good materials and very helpful materials. Temperature checks have been included in every single industry's reopening. So I think that it is important part of the program of returning people back to work, making sure that you have some type of assessment of people's health to be cautious and to protect the county and to avoid the further spread of the virus in your area. Union issues. So far, unions have been very supportive of the temperature checks. There have been some issues that have come up with respect to confidentiality, but is it a mandatory subject of bargaining? Probably would be under normal standards of New York law, but we really haven't seen a lot of activity around that. Unions have been supportive. It is helpful to make sure that if you're communicating with employees about temperature checks, that you give the union a heads up to let them know that has seemed to head off a lot of some of the issues. But I would argue that temperature checks are recommended in all of the New York Forward materials, though not specifically applicable to municipalities. It's a health and safety matter. The employer has the right to implement that health and safety protection. And if the union wants to discuss that matter, that it would be an effects bargaining or an impact bargaining type of circumstance. That's the position that county employers really should be taking with respect to temperature checks, because it's a health and safety measure. On the next slide, Bill and I really don't recommend collection of medical information. So some of you will need to use some type of form to perform the health screening. Like I said, some of you just use a one-time document where an employee certifies, if I have any of these symptoms, they're listed, that I will notify whoever the appointed person is in the county for notification. If you do have that type of document, and it doesn't ask the employee if they presently have any of those symptoms, that's not a document that you necessarily need to keep confidential. But if it says, I do not now have the following symptoms, and I will advise if I do have these symptoms, that has medical information on it. And the Americans with Disability Act has very strict rules about the maintenance of medical information. So best practice, if possible, not creating a log, using a real-time thermometer that's a no-touch type of thermometer, immediately informing an employee in a confidential area that their temperature is above 100.4 degrees, and not maintain any documentation regarding that type of thing. And then the next slide has all the details for you regarding screening safety. And these are very important. I went through some of these, making sure you have social distancing in line, maybe private areas outside for the screening, multiple areas, enough to manage that flow so you're not creating any congestion. And like I said, the EEOC requiring those screeners to have specific training regarding confidentiality of medical information. And then the next slide is, are you allowed to require or administer a COVID-19 test before permitting employees to enter the workplace? And the EEOC has answered that question affirmative. An employer is able to do that. And so that's good news, that's clearly a medical exam, but in the light of the epidemic, it's an allowable medical examination, so that you do have a right to perform that if you feel it's necessary. On the next slide, we just review some of the important confidentiality components. During this pandemic, we've seen a lot of employees saying, well, you can't check my temperature, or you can't ask me those questions because of HIPAA. So I thought it was important to remind everybody that HIPAA really doesn't apply in that employee-employer type of situation. So we are allowed to check temperatures. We are allowed to collect information. The law that applies is the Americans with Disabilities Act requirement to keep any medical information confidential, but HIPAA really is inapplicable in this circumstance. HIPAA becomes applicable when we're, as a county, requesting information from a provider, a health provider of the employee. That doctor's office or hospital is going to have to follow HIPAA laws in terms of providing us with information. But generally, if we're receiving information from an employee, that's not going to be a HIPAA protected situation. So I know that a lot of you have been dealing with that question, so I did want to mention that. The other important point from both the CDC and the EEOC is that if you do have knowledge that of a positive COVID-19 positive diagnosis, that we need to not share the name, never share the name of the employee. You're allowed to write letters, and you should, the CDC says, communicate with employees. There's a positive COVID case on the 4th floor of the such and such building, but never specifically identifying an individual. So we also have developed sample communications for employees that don't identify the particular employee, but do give people information if there's a positive case in the area. They're going to need to know about it for their own health and safety. We may actually be quarantining individuals as a result of any exposure, and we're certainly going to be disinfecting the area. The EEOC has indicated that they are expecting a designated staff member who receives information. And it doesn't have to be one person, but there should be, in larger counties, multiple designated staff members who will be receiving information about the identity of COVID positive individuals. And that should be a very limited number of individuals who understand the Americans with Disabilities Act and the importance of confidentiality of medical information. So on the next slide, Bill and I have listed for you the different types of policies that we've mentioned throughout the program that we feel you will need to revise in advance of the reopening. These were everything that we could think of in terms of existing policies. There might be other policies that you have in place that you will need to modify as well, but these are sort of the big items. The travel policy I want to call particular attention to. You need to have a policy in place if you don't already on travel. And it can be very specific. It probably should be very specific to the particular circumstance that we find ourselves in. It's extremely rare that domestic travel would be a high-risk activity, but there will be some people that will be traveling during the summer months to different areas of the state. So you should have a county policy in place of what you're going to do with those individuals, how you're going to manage that. Are there notification requirements? Do you have days that the person cannot come into the workplace? Will they be paid post-vacation, unpaid? Those are certainly policies and items that the unions are going to want to weigh in on in terms of employees that are covered by union contracts. And very similar to the other policy I mentioned, employers should probably take the stance that these are matters of health and safety, even life and death in certain circumstances, and therefore we have the right to implement it, but we certainly will be talking to the union about the effects of that. And I would think certainly whether or not you pay an employee, not pay an employee pursuant to your policy, the union would have absolute right to discuss those things with the employer. So that is probably something that needs some advanced preparation because it will involve discussions with the union necessarily. And then policies in place regarding return to work after sickness or exposure. We worked with NYSAC to prepare a very good document regarding return to work after exposure, and there's different categories. We have that available. We won't go into detail in it. We're certainly already getting over time here. So I want to make sure that we get through these last few slides and wrap up. But we can provide that material to you at your request. On the next slide, exposure prevention and response plan. These are the 4 different scenarios that you need to have a plan for. These are the areas that are covered in that document that I mentioned that we had worked with NYSAC to prepare, but you do need to make sure that you have a clear procedure and policy for employees test positive, an employee who's symptomatic, having some of those symptoms that we listed on the other slide, but no positive test, asymptomatic employees who have been exposed, and then return to work after exposure or sickness. The New York State Department of Health on May 31st published a guidance document for public and private employees returning to work following COVID-19 infection and exposure. It's very important that your policy include this information from the New York State Department of Health in terms of their requirement, but generally they're requiring 10 days of isolation after a positive test, and they're requiring 14 days of self-quarantine for individuals who have been in close contact with a person who's infected with COVID-19. There's a very large area for exceptions in the New York State May 25th Department of Health guideline for if a county deems an employee to be an essential or critical employee for the operations, that we can use other protocols like masks, social distance, cleaning and disinfecting workplaces, monitoring, or even requiring tests of the employee. So that May 31st document pretty much is going to establish your policy here for creating procedures in the 4 scenarios that we've listed. On the next slide, it's a part of what we worked with NYSAC to build, but there's something that's another important part of return to work safety, and that's to have a workplace contact tracing program. And I know we've all been dealing with contact tracing in the Department of Health sense. This is separate, very similar but separate. This is probably an HR team that's led by human resources, and you're working with other individuals from different areas of the county, called a workplace contact tracing team, where this team is going to deploy very similar to how your Department of Health investigators have been working when there's positive cases in the community, to rapidly identify any area of possible transmission, identify areas that need to be cleaned when we have positive employees. And this is facilitated through other types of policies that you may decide to implement. So some counties are deciding to have tracking where employees are submitting to their supervisors on a daily basis, maybe even real-time basis logs of who they've been meeting with, where they've been in the buildings, so that if there is a positive case, that this workplace contact tracing team could immediately have access from the department of everywhere that the positive employee has been, so that they're not wasting time trying to put together the whereabouts of the individual and the possible spread. So that's a highly recommended approach, maintaining logs of people's meetings, movements, who they're talking to, where they've been in the building, so that if they do become infected, that information is readily available and can be acted upon by the workplace contact tracing team. These may also be the appropriate individuals who are notified to handle positive cases in accordance with the EEOC standards, to have the designated point people handling positive case information in the workplace. So we did just want to put that slide there for you so that you can be working on getting that workplace contact tracing team in place. On the next slide, just a list of questions that employees have been asking that you will be confronted with as you reopen, if you haven't already been already, so that you can start thinking about getting ready for this. On the last bullet, I did want to mention something that Steve Aquario mentioned in the beginning of the program, and it has to do a bit with unemployment. So a lot of you have been looking very carefully, or already initiated with the shared work program through the New York State Department of Labor. And we really have some concern about this over the past few days, in that under that program, the law says that, so this is a situation where, for those of you that aren't familiar, that in lieu of a layoff, you might furlough employees and cut their hours. Under the shared work program, the New York State will pick up the furloughed hours and pay the employee through unemployment on those furloughed hours. So they're partially unemployed individuals rather than completely laid off. The statute said that there will be no reduction in benefits to the employees. So that had been certainly understood as no reduction in retirement credits. So unlike a laid off person who's not receiving credits for purposes of retirement, that this program would allow an employee to continue to receive their credits. The New York State Department of Labor has taken the position that they're not going to receive credits. Employees will not receive credits for unemployment. And as of yesterday, we unfortunately had heard that New York State Department of Labor may be taking the position that they're no longer going to extend this benefit to public sector employers. So that is something to be very careful about as we approach it. I am sure that the New York State Association of Counties will be continuing to monitor that situation, but I know a lot of us have been looking very carefully at that as a great option in lieu of layoffs for employees. So that might not be available, and we have to be very careful around that. And the other question that comes up a lot is workers' compensation. Will it apply? And New York State Workers' Compensation Board has put out a COVID-19 Q&A, and the answer is yes, that depending on the facts, meaning if an employee can prove workplace exposure or likely workplace exposure, excuse me, they will be entitled to workers' compensation in New York State. Not all states have taken that position, but New York State has, so that's important to keep in mind as well. So those are sort of the personnel issues that we've been seeing questions on. And the next few slides are the union issues that we've been seeing. A reminder about the duty to bargain. That duty to bargain in New York State is extremely broad. We have to bargain with unions about anything related to wages, hours, terms and conditions of employment. So remember that even in an emergency, PERB really has never laid out any clear doctrine for us on what happens in an emergency, and PERB has not specifically identified or addressed their position on COVID-19 like other states have. So like California's PERB has specifically addressed its stance on mandatory bargaining. I believe that PERB silence really indicates that everything in the Taylor law continues to apply. There is an emergency doctrine that I did want to mention. Under the Taylor law, we can make unilateral changes as management in emergency circumstances, including things like scheduling, staff changes, even if they conflict with union contracts. But we first, before we can make those unilateral changes, we have an obligation to negotiate until impasse. So if there is something that you're thinking is certainly going to be a change to wages, hours, terms and conditions of employment, but you believe it's imperative related to COVID-19, you need to initiate negotiations now and fast track it in the event that you need to get to that genuine impasse because implementing is important. Now, I do want to remind you or teach you here, if you didn't already know this, monetary savings are not a valid basis to invoke this emergency doctrine that PERB has available. So this would have to be a health and safety issue related to a workplace matter, like temperature checks, for example, that the union is, asserting that they have the right to negotiate some aspect of it, and you begin to initiate that negotiations. You might want to fast track that, reach impasse, and have the right under this doctrine to implement unilateral changes. So that was important to mention. The next slide, we've been seeing some issues with meetings. I think as counties begin to reopen, the unions are going to want to begin to meet, and we believe they're going to be raising a lot of issues that they haven't raised so far during the crisis, because it will be believed that, we're reopening, the crisis is largely over, even though emergency orders are still in place. So human resources staff, labor relations staff might need to have extra support in place, because we do expect that there's going to be a lot of pent-up arbitrations, a lot of various union meetings, investigatory interviews that need to happen. So making sure that your human resources and labor relations staff have the support they need in place to handle what is really going to be a flood for these individuals that have already been dealing with a lot during the crisis already. They're facing their next wave of challenges with all of these different meetings. And then on the next slide, we've listed the issues that labor relations staff are going to have to be dealing with here. Hazard pay is going to continue to come up as an item that the unions want to negotiate. There's no rule on whether or not you have to provide hazard pay. It's completely a matter of discretion for the county. I will mention, if it helps some counties, under the National Labor Relations Act, which applies to private employers, hazard pay is not something that employees are allowed to push to a strike. So it's considered a sensitive area of negotiations in the private sector. And so I think we'll be seeing some case law develop in PERB in terms of where the unions want to take that hazard pay. We've seen a lot of that request related to testing that's required for your healthcare employees and your nursing homes and other healthcare employees that are required to test twice a week. Certainly the unions, if they haven't already, they want to negotiate compensation for that testing. So to the extent you've been able to keep that testing during the regular work hours, maybe you're going to be able to avoid those conversations, though with the testing that we've had to do and the amount of testing, I know a lot of you have had to schedule that outside of work hours. You may need to, given the economic circumstances we are all facing as municipalities, you may feel that you need to reopen contract negotiations to discuss wages. The unions can reject that, but you do have the right to request a reopening if you are not able to provide the raises that you've already negotiated. Maybe there's other structural things that the union might want and will be willing to trade off on already pre-negotiated items that you feel that you're not able to sustain in light of the economic circumstances. Without a reopening, you really are forced to continue to provide the benefits that you've negotiated already in the contracts. I do want to mention that a lot of times when municipalities ask to reopen contracts, the unions will come back with a proposal for a no layoff clause. Want to remind us all that that type of proposal is considered a non-mandatory subject of bargaining. So you can reject that, and you can tell under PERB case law, you can tell the union that you do not need to discuss that the county has an unfettered right to lay off employees. It's one of the only avenues that we have to manage when we have closed contracts and financial issues. So that is a non-mandatory subject, and the union is not going to be able to push that forward or hold up contract negotiations. It's actually chargeable conduct, improper practice charge material, if the union keeps insisting on a no layoff clause. So I thought it would be good to reinforce that information for you because we will likely see a lot of those requests in the next coming months from the union, no layoffs. Try to resist those as much as possible. So I'm sorry that we went over here, but that does conclude everything that we wanted to provide to you by way of material, and we're available to answer any questions if we haven't already covered them in the presentation.
Hi, this is Mark Levine, the Deputy Director of the New York State Association of Counties. I want to thank Karlee and William and ask for you to stick around for a few more minutes. We have a handful of questions from attendees that I would like to get through. Is that okay, Karlee and William?
Yes, we certainly kept people here 23 minutes beyond their scheduled presentation, so we are happy to stick around and answer the questions.
Okay, great, and thank you. And again, this is being recorded, so if you have to get off now, you can catch this later when it's posted on our NYSAC TV YouTube website. I also want to just mention that the document that Karlee referred to in a few of her slides that they worked on for NYSAC is called the County Government Workforce Reentry Guide, and it's available on our website at www.nysac.org/reopen, and it will also be available under the slides on the webinar page of the NYSAC website. I think you've mostly answered this, Karlee, but can you please clarify the travel restrictions for employees to come back to work? So are there recommendations that you would have for counties setting restrictions or setting a policy for those employees who travel and then come back to work?
Okay, great, sure. So I was moving so quickly through those slides, but I appreciate the question because I did want to address it. Travel restrictions are completely up to the county. There's nothing contained in any specific law that requires a travel policy. It's a recommendation. Bill and I really try to look at this as you're developing your reopening plans, you're thinking about, we want our government to avoid further contagion in our community, particularly in our employee community. And so we sort of tend to lean towards more restriction in terms of what the employees are doing, at least until we have a better feel of the virus and how things are going to go with reopening. So our recommendation on travel policies is maybe more restrictive than other people might like or that other people might advise. So certainly get other opinions regarding this. But we've been crafting, we'll listen to the county and hear what the county wants, listen to the different aspects that the county is trying to manage and help craft a policy that works for any county. But if we were just creating one for like the safest possible reopening, we would put in that policy, and we've written these if people need samples, no business travel, at least until we can get a handle on travel and the effects of travel, and then to slowly start to implement travel in a phased-in type of approach, business travel, and that we believe that we really don't have the absolute right to restrict personal travel, but to build into the policies that we strongly discourage personal travel, linked to the CDC rules regarding personal travel that really teach employees how high risk even domestic travel is today. The CDC is strongly recommending against any cruising on cruise ships. So if people have those plans over the summer, because we believe that we don't have the absolute right as an employer to restrict personal travel, particularly as a public employer, we're recommending an education program a brief education program that would go with the training that you provide to employees regarding personal hygiene and PPE and social distancing, that you would add travel and the risks associated with travel and the effects that travel could have on the employee. So we do have sort of a two-part policy recommendation: no business travel with a phased-in approach to business travel. That will require department heads to identify any upcoming travel, any areas where employees are traveling, making determinations whether certain travel, you know, if it's an hour or two away, is that acceptable versus travel on an airplane? Probably. So our policies tend to include, you know, less restrictions for car travel versus plane travel. And that our policies include recommendations that employees do notify supervisors, or maybe it's that contact tracing team regarding their personal travel that's, you know, in areas outside of the state, to at least notify and maybe have some, rather than prohibiting the employee from coming into the workplace, which I think will raise too many issues with the unions as we move forward, and even just with the employees personally, that we use PPE when an employee returns after personal travel, so that we're not prohibiting the personal travel, but if the employee does travel, that we have very set PPE protocols in place and social distancing protocols in place, much like we would do with an employee who was exposed. So treating the traveling employee as if they were an exposed employee. And then there's certain areas of essential staffing that will travel, and then maybe we're going to require testing, COVID tests, before they can return, and maybe for a certain number of days after they return is another good alternative to have as an option in your travel policy.
Great, thank you very much. Before the next question, I want to, while we still have some people on, again, thank our webinar sponsor, OpenGov. OpenGov has the only integrated cloud solution on the market, providing local government leaders with user-friendly technology solutions for all budgeting, financials, performance, communications, reporting, and permitting needs. It's www.opengov.com. What is the answer for public-facing county offices? Can we require the public to be required to wear masks when they come into our offices?
So the answer is yes. You may require it, and the recommendation from us is that you should. So if there's space 6 feet or more between the employee, or if you can use like a plexiglass shield of some sort, maybe not necessarily, but if those things are not practical, then definitely require the mask. Don't allow the public to be within 6 feet of an employee if the public won't be masked. Now, I should mention that there are reasons why people can't be masked, and the public certainly will probably raise some of these issues, and employees will raise these issues. A lot of individuals that we might not even realize are hard of hearing are using people's mouths to understand their facial gestures, to understand the words that they're saying, even more sometimes than their actual hearing. And so those employees will be coming forward probably to let you know that the mask is really a problem for them. That means that they really can't wear it and the public can't wear it. In those circumstances, we really need to get the distance in place. And we would recommend like a plexiglass, or if there's no plexiglass available, face shield would be the next appropriate measure there. If you're using a face shield without a mask, the CDC recommends the 6 feet or more apart and the face shield. And that should work in those, unless there's like a physical space issue, and that should be identified before employees are brought back to work. So that particular service maybe can be moved to an area that has more space so that we can keep people apart.
What about employees that are in the same household with a spouse or a child that are high risk, i.e. undergoing chemotherapy? Are there reasonable accommodations applicable here?
So in the training that the EEOC recently put out, they indicated that that's not a covered situation. So a disability of a family member is not an employee disability that requires accommodations. However, most employers, just from an employee relations standpoint, have been doing their best to try to accommodate those situations. And like I mentioned earlier, PPE is really probably the best solution here to those circumstances. A lot of employees, as I mentioned, are coming forward with doctor's notes saying they need to continue to work from home. Let's say that person works in the Department of Mental Health. Right now, they're able to perform telemedicine because we have the state waiver in place. But that state waiver might not be in place for very long, including for some of our Department of Social Service activities as well. The waivers might not continue to be in place to perform our services remotely. So, if we do use, continue to allow people to telework, we need to be very clear that that's only being continued on a very limited basis, and really try to move towards more PPE to make that person feel safe. So we recommend listening to what the employee has to say and educating the employee about all the PPE measures that you can put in place and all the other safety measures that you've already put in place. The things that Bill talked about creating traffic flow that avoids congestion, the regular cleaning and disinfection that's going to occur, the limitations on the break rooms and other shared areas. So educating that employee about the safety measures that you've put in place.
And just to add on to that, I think that gets to a point I made about ensuring that you have a policy in place. So there will inevitably be many situations where an employee doesn't have a disability for purposes of the ADA, but you still want to respond and react to the issue they're presenting. So you need to make sure that you've talked to supervisors, you've talked to managers about how to handle these types of requests where we may not necessarily just follow our standard ADA reasonable accommodation process because this may fall outside of that. So you have some latitude there to decide as a county, how do we want to handle these? And then while it may not fall within the ADA, that doesn't mean you're foreclosed from using those 3 types of accommodations that we talked about at the beginning. As Karlee just mentioned, the additional or enhanced PPE for folks who, while they personally may not be at high risk, may live with high risk folks, and the PPE would serve the same purpose there. Or in the alternative, those other accommodations of leave or teleworking. So I think that ties in nicely to the general point about it's critical to have a clear policy on how to handle these types of questions so that we can have kind of consistency across the organization and how we handle them.
Okay, great. Just 2 more questions. I think we can get through them pretty quickly. Do you recommend that screening take place inside the building or just out at the front door?
So we recommend just outside the door because that's the CDC recommendation. So we try to stick with the CDC recommendations as much as possible, and the employer should as well. So if you can set up like a tenting area just outside the door, that's best. That might become difficult as we get into the winter months. So I think it is important to have there could be a natural disaster. So it's important to have an inside area that you would also use that's roped off, taped off, somehow marked as a screening area only so that other individuals don't go into that area because that's potentially an area of exposure. So if you can't do outside, use the marked off interior area and always have that plan ready in case the outside is not feasible. We've seen some problems with the tenting already with microbursts and high winds where that's not going to work for the day and the employer didn't have a backup plan in place for the interior screening. That sort of raises a question too on whether or not you want to screen employees in the same area that you're screening visitors. Our recommendation is to have 2 separate screenings, one for employees, one for visitors.
Okay,
a lot of reasons for that.
Again, we will get answers to all these questions and send an email to everyone. One last question before I thank you and send everybody on their way this morning is, how does a county isolate a workstation of a COVID-19 positive employee for cleaning purposes without making it obvious to the person's coworkers?
Yeah, that's a great question. Unfortunately, a lot of what we do is obvious. to the coworkers. They will be able to tell, or at least I narrowed down the number of employees. EEOC is aware of that, and all they've told us is that we're prohibited from mentioning the name. So they understand that some things we might be doing might be strong indicators of who the employee is. When we face that question, we recommend anyway, in accordance with the CDC guidance, a larger area cleaning. So multiple individuals should be removed and larger areas should be cleaned anyway. So an employer really, if they're following the CDC cleaning and disinfection guide, they're not just cleaning one workstation, they're cleaning all of the surrounding stations as well. Now, it also becomes obvious when that person is not at work and people start talking. This is where anti-retaliation training is also important, to remind employees that we cannot discriminate, harass, or otherwise retaliate against individuals with a medical condition. Now, the EEOC has indicated that it has not set on whether or not COVID-19 is actually a disability, but I think we really ought to treat it as such, and we shouldn't allow people to be gossiping or discussing so-and-so is out, they had this is where they got it, they were working in this other place, blah, blah, blah. We shouldn't allow employees to be doing that, and the way to start preventing that is through employee education before it happens. So if you're building this training program, which we highly recommend, one for employees and one for supervisors, that anti-retaliation and confidentiality be taught to everybody at the outset, and then supervisors need to be taught to nip that in the bud when they see employees starting to go in that direction.
Okay, great. So a couple more thank yous to close down this webinar. Thank you for NYSAC members who joined us this morning for this very informative webinar. We appreciate you taking the time to join us, and we hope that you got some value out of it. And if you have any questions, please send us an email, and we will get those questions answered. Thank you again to Karlee and William for your expertise and your time this morning to help inform our members about reopening their county governments. And last but not least, OpenGov, who was the sponsor for today's webinar. Thank you all very much, and have a great day.